Hello, everybody, and welcome to the lunchtime talk for healthcare tech. Thank you for joining me during your lunch break or whichever time zone you're at. I'm Dr. Nadia Boutawi, and today we will be covering the 5 healthcare technology trends in 2022. So briefly, we will be covering 5 topics. The first one is the wearables and remote patient monitoring technologies, the Internet of Medical Things, cybersecurity, and big data and predictive analytics, as well as virtual reality and augmented reality for medical applications. So let's get started. Briefly, I am Dr. Nadia Boutawi. I'm very passionate about moving healthcare technologies to the market or expanding existing healthcare technologies and moving them to different market segments so they can help most people. So if you are a healthcare tech company who needs help with their medical technologies to expand to new markets, feel free to reach out to me. Book a 30-minute free call with me to evaluate your next market for your healthcare tech. And with that, I'd love to know if you're watching me live or if you are watching the recording. So yeah, please put in live in the comment section if you're watching live. I'd love to know where you're connected from too. It's always exciting to see where people are connected from during the live sessions. So with that, we'll get started. The first trend I see in the healthcare tech space is within the wearables and remote patient monitoring. So the real-time monitoring, especially for preventive healthcare measures, is so important because a lot of diseases cost so much money in the healthcare system, especially here in the US. To give you an example, monitoring heart disease costs $360 billion per year. Blood pressure between $130 and $200 billion. Diabetes, in every $4 spent in healthcare is diabetes related in the US. That's a staggering $325 billion. Another one that's big is the non-compliance for medications. Non-medication adherence in the US costs $300 billion unnecessary medical expenditures that could have been prevented. So I'll see that there will be a lot of tech innovations around smart pills for medication compliance, especially for chronic diseases that are big drivers of healthcare costs in the US. The next thing that I think is important, and we've seen hands-on over the past 2 years, the uptake in telemedicine to deliver healthcare services remotely. So we will continue to see the move of healthcare services to decide which services will stay actually to be delivered remotely while still delivering quality services or quality healthcare services to the patients. So a lot of hospital systems or healthcare delivery systems, private or not-for-profit, will have to decide which of the services are they still continue to deliver remotely without affecting the quality of the service they provide. This is especially important because a lot of nonprofit, they operate on a very small margin between 1 to 7% at best. So we will continue to see that trend to continue to go. This is especially important for delivering services in remote areas that don't have specialists or enough medical professionals to provide the care. The Internet of Medical Things will also be used a lot in real-time tracking of both equipment and drugs to improve operational efficiencies. As I mentioned, most healthcare systems operate on a very small margin, so it's very important to optimize the efficiencies of their existing equipment or upcoming equipment. And the same goes for drug uses. The next one is cybersecurity and data interoperability. Black Carbon, a cybersecurity company, reported there was close to 10,000% increase in cyber attacks between 2019 and 2020. That's a big jump. So the demand for cybersecurity in healthcare will continue to grow, not just in 2022, but for years to come. In regards to interoperability between providers and medical developers, I see that there will be improvement in that seamless interoperation between medical device developers and healthcare systems. And a lot of medtech companies moved from the hardware component into the service-based delivering of healthcare. So I see that there will be a lot of efforts, continued efforts, in terms of improving the connectivity or interoperability between medical devices and providers, healthcare providers. The next one is big data and predictive analytics. So we are in an era where we have so much data that can be used to improve efficiencies, to improve the healthcare services for the patient ultimately. And the other thing is that here in the US, patients now have the right to share their healthcare data. And that's a big chance that gives them more autonomy over their healthcare data. And that will increase that flow of information between healthcare providers, patients, and so on. So there will continue to be improvement in interoperation between providers and investment in infrastructure in order to leverage predictive data analytics to improve the efficiencies of patient care. Why is that important? There is a move within the US away from the fee-for-service model, payment model, into the quality-based service model by the Center of Medicare Services, which is the largest payer in the US. In doing so, a lot of hospital systems, they have an incentive that if you're delivering better quality, your reimbursement will be better. So there is a lot of investment in infrastructure and how to use those predictive analytics for preventing heavy usage of certain services such as emergency room. For example, I'll give you an example. Asthma or respiratory diseases are one of the major users of emergency room visits. So if we can use data to predict which, before they need an emergency room, which patients they need to see their primary care physician or their specialist before they need to go to the ER, which is more expensive to deliver the care. And perhaps the quality of the care is less because of how much pressure there is on the emergency rooms. So we will continue to see a lot of moves towards using predictive analytics and big data to improve not only the efficiency of patient care, but the quality of patient care, hopefully to move from intervention medicine delivery model to preventive delivery model. The next one, in terms of delivering trends in healthcare, especially with the Web3 upon us, and is the use of virtual reality and augmented reality for training for upskilling medical professionals, meaning that if they need to improve certain technique or certain way of doing things, such as in surgery, which is one of the more expensive workforce out there in the medical field. So instead of the surgeon taking time off, going to another place to do a training, which will cost the hospital system a lot of money, they can do that virtually. In terms of the ICU, the intensive care units, and we've seen that over the past 2 years, how much pressure there was on intensive care units, is how to use VR and AR to retrain or reskill other professionals. So in case of emergencies, you can move, you have the ability to move your medical professionals to certain, to the ICU, for example. That is very important, especially that uh, healthcare professionals are experiencing a lot of pressure and, frankly, a lot of burnout. So, if there are ways that can help train or upskill or even reskill them without taking time to do so, that would be of great value, not only to the healthcare systems, but to the medical professionals. This can be done through what's called gamification of content for training. So the training would be almost like a game. I give an example of the the language learning apps that they would learn through games. So the same idea can be applied as well for VR and AR for medical training or upskilling of medical professionals. VR and AR also has great applications for patient care delivery. For example, for exercise rehabilitation. The patients, they can, without going to facilities, they can do certain exercises through VR or AR within their home setting. And this is important for two reasons. The quality of life, so they don't have to go while they're sick on a regular basis to certain facilities, not only for them, for whoever is caring for them who needs to take time off their work to take them to the rehab sessions and so on. And in most cases, it is for a long period of time on a regular basis. So that would be, if they can do that within the comfort of their homes, that would be of great value for the patients and their caregivers. So those are the main things to recap. The main things that I see, the five big trends in the healthcare technology space in the coming year, not just in 2022, but 2022 and beyond. So to recap, those five trends include wearable and remote patient monitoring, the Internet of Medical Things, not only for telemedicine, but for tracking, real-time tracking of equipment and drug use, cybersecurity and data interoperations between medtech and healthcare providers, and even between different healthcare providers, because right now they are very siloed. The fourth one is the big data and predictive analytics to improve not only the quality of patient care, but the efficiency of delivering that care. And the last one is the use of virtual and augmented reality, not only for training through gamification, but also to deliver care for patients in the comforts of their home. So those are the five things that I think will still be big or gain more traction in the coming years. And yeah, thank you for being here. I really appreciate you taking time within your busy schedules to join me here for this healthcare tech lunchtime talk. If you are a healthcare tech company and need help either moving your technology to the market or expanding your existing technology to a new market, you can go to my featured section on LinkedIn and book a 30-minute with me so we can evaluate the potential of moving your tech to a bigger market to grow, and more importantly, so you can help the people you intend to help. Again, I'm Dr. Nadia Boutawi. I'm a business strategist and I help move technologies, healthcare technologies to the market. Thank you for your time. I'm going to go ahead and see if you have any questions. Please feel free to put them in the chat. I will have a few minutes to answer some questions. I'm seeing here, hello from few people from Algeria. Thank you for being here. Hi, Ben. Thanks a lot for being here, taking time to be here within your busy schedule. Yeah, go Steelers. I'll always be a Steeler fan. We have few people from Algeria. And yeah, thank you, Lilia, for being here. Appreciate you. Yeah, if you have any questions, please feel free to put them in the comment section. And yeah, even if you're watching this on a recorded session and you have questions, feel free to type them in the comments and I will go back and answer them after the live. And with that, I appreciate you being here. Again, I'm Dr. Nadia Boutawi. If you are a healthcare tech company and need help evaluate your technology or strategies how to move to expand to new markets, please feel free to join me, book a 30-minute session with me through the featured section on my LinkedIn profile. And with that, have a great day and enjoy the rest of your week. Bye.